Welcome back to Radio Entrepreneurs. My name is Jeffrey Davis. I'm the host of the show, and we are speaking to one entrepreneur after the other. One of my favorite topics is always anything that deals with innovation in healthcare. And just before we get into that, my co-host today is Peter Myerson from the law firm Cohn, Rasnick, Myerson & Plout. Welcome, Peter.
Thank you, Jeffrey. Great to be here.
Thank you very much. And Peter, we're going to talk about a subject which we hope we both don't ever have to deal with, and that's catheter for heart ablation, right?
But I already have, so.
You already have? Wow. And if we're going to talk about that subject, the only person I know who's actually versed in that subject is Marty Sklar of AblaCor Medical Corporation. Welcome.
Thank you very much. Good morning.
So is this a big topic?
It's big and growing. It's a major problem. Millions of people have it in the United States.
Millions.
In worldwide, estimated about 30 million worldwide and growing. As the population ages, it's getting more and more prevalent.
What do they have? I mean,
how would you know you have it?
Well, sometimes you don't. About half the people are asymptomatic. They don't have symptoms, and so they go around, and until they get an actual exam by a doctor and have an EKG or something like that, or at least somebody listens to your heart, they won't know they have it if it's not symptomatic. But if you're symptomatic, you'll know it because you become faint, you heart difficult walking, you have problems climbing stairs, lifting a child. Atrial fibrillation is the most common and most complex electrical problem in the heart.
And so 30 million people?
30 million worldwide. And like I said, the numbers are growing. The estimates were a couple of years ago, there were only 10 million
What's
worldwide.
causing it?
Well, there's two aspects. One is the older population. As people grow older, there's more chance of having it, and there's better diagnostic capabilities than there were decades ago. So now it's becoming more prevalent from a diagnosis. So both are contributing to the growing numbers, and that's a real big issue because now we have to find a way to treat it. People are coming back to the hospital more regularly with these symptoms.
And so what do you think you can do about it?
Well, the most common treatment and most effective treatment up to now is this ablation procedure that I've discussed in a previous interview as well. And ablation is done about 130,000 in the U.S. and maybe double that worldwide. And the problem is 40% of them are repeats, approximately 40%. And as a result of that, people come back 2 and 3 times for a treatment. Well, ideally, if you're going to have a treatment, you want to have it one time and be done with it. So our catheter system that we're developing will very likely bring this down to a very small number of repeats. We're talking maybe 5% of the people would have to be treated again, approximately. But the idea is to make this repeatable so doctors can do this more effectively. More doctors can treat patients. Right now, electrophysiologists who perform the procedure are, in fact, there's about maybe 2,500, 3,000 in the U.S. We figure about a third of them, about 800 to 1,000, perform most of these procedures. More don't do it because it's very highly it's a very difficult procedure. It's not cost effective for them to do it. And because of the fact they have to go back and do it 2 or 3 times, it's problematic. The procedures are tedious, they're long, they're difficult. We would make this a much more simplified procedure that a doctor can perform in a much shorter period of time and do it more effectively than what's out on the market today.
So where are you in your developmental process?
We are in the early stages. We're looking for financing. We've developed some prototypes. We've done some testing on tissue and shown that in comparison to existing products, we can develop a better ablation device than what's out there. We have tremendous doctors looking to test this in animals, in live tests. We haven't done that yet. The reason we haven't done it is because we haven't enough money to build enough prototypes. That's really where we need to go next. That's crucial that we get there.
Is building the prototypes?
Building the prototypes and getting it tested in live animals and then into humans. We can do that fairly rapidly once we have the money.
Is that hard to do?
It's hard to do from a financial standpoint. It is because it's going to take a few millions of dollars to get it on the market. But from an early stage standpoint, we're talking about $1 million just to get to the first set of animals and get it ready to go into humans. We'll connect up with some existing product, but we have a disposable product that it's like a razor blade kind of a thing to the razor, and that will make this a very effective business opportunity as well for financial people looking to invest in medical devices.
Marty, obviously, I think a topic as you get older that we're all interested in, and less invasive types of surgery. If somebody wants to contact you and maybe help you out with AblaCor, how can they find you?
Well, other than going to the website, ablacor.com, ABLACOR.com, my cell phone is 781-248-6841, direct to me. And my email is msklar, msklar at AblaCor.com.